Hi everyone, Dr. Nemechek here. I want to touch on Lyme disease. I'm an internal medicine doc. I've got a particular focus on infectious diseases because of my HIV background. And all I can say is there's all sorts of alternative medicine physicians, not even physicians sometimes, and the just gross overdiagnosis of Lyme disease or multiple infections at one time in kids. All right. I see this all the time. Parents come in with testing. The testing is not even really valid, or because it's not even done with proper techniques, or it's the test itself will say it doesn't meet the criteria, and the doctors will say, "Oh no, it is anyhow." And it's just totally out of hand. If somebody is saying your child might have Lyme disease, you go to an infectious disease specialist to get it confirmed. Do not start on treatment without doing that. And in kids, if you don't have 95% of the kids are going to have erythema migrans. It's the rash that's associated with Lyme disease. If you don't have that, you're already way against the diagnosis likelihood of having Lyme disease. All right. Now, another thing that I find just abhorrent is we've had a couple moms carrying around this guilt for years that their autism was caused by Lyme disease that the mother gave to the child during pregnancy. Congenital Lyme disease. Okay? One, that's a horrible thing to place upon anybody. The guilt of that has got to be incredible. And two, there's no evidence such a thing exists. Okay? And there's no evidence like Lyme disease can be passed through breast milk. Okay? There's no congenital Lyme disease. If anybody your kid's got developmental delay or they're stimming or whatever, you're going and getting an opinion about it. And they run a bunch of tests, and one of many different things is Lyme disease. They're like, oh, you got Lyme disease. Do not start treatment. Go straight to an infectious disease doctor and make sure that's what really is going on here. And every single time somebody has followed my instructions, the infectious disease doc says, no, your child doesn't have Lyme disease. Okay? Why is it important? Because some of these treatments can harm your kid, and it's usually like tons of antibiotics. So thanks for letting me get that off my chest. I've just had it happened again this week to one of these mothers, and it just really angered me that this kind of nonsense is going on out there. So there is no congenital Lyme disease, and be highly, highly suspect that the Lyme diagnosis is true. Oh, I just add one more point. And sometimes they'll say, well, we gave him antibiotics and he did a little better. Well, those antibiotics might positively affect your SIBO for a little bit. Okay, that's no proof that the diagnosis was correct. Okay. All right. I promise the next one I'll be in a better mood. Everybody have a great day. Bye.